A 78-year-old male patient with a right indirect inguinal hernia underwent repair. Utilizing the single-port laparoscopic advanced percutaneous internal repair system (APIRS) technique. An optimal skin entry site was selected, and the suture guide needle, loaded with a suture, was introduced through the abdominal wall and advanced into the preperitoneal space. The lower half of the internal ring was carefully dissected using the needle tip, which was precisely positioned between the peritoneal layer and the gonadal vessels, as well as the vas deferens, ensuring these structures were safely bypassed. The needle was then used to puncture the peritoneum. A suture loop was created within the abdominal cavity by advancing the suture, after which the suture guide needle was withdrawn. A second suture was loaded into the suture guide needle, which was then inserted through the same skin puncture site. Dissection proceeded along the upper half of the internal ring opening, following the preperitoneal space until the previously made peritoneal puncture was reached. The needle tip was passed through the loop of the first suture. The first suture was gently tightened to reduce the loop and secure the suture guide needle. The second suture was advanced approximately 15 centimeters into the abdominal cavity. The suture guide needle and the first suture were sequentially removed. The second suture followed the path created by the first, encircling the internal ring at the preperitoneal level. The internal ring was successfully closed by extracorporeal tying of the second suture.